So first of all, I'd like to welcome all of you to our webinar here on IBS on behalf of Dr. Jose Lara, Dr. Tim Lind, and all the staff here at Gonstead Physical Medicine. Again, welcome to you. Our topic tonight is combating IBS, understanding and recovering from digestive disorders. Again, this is presented to you by Gonstead Physical Medicine. I know most of you are patients here at the office tuning in, but there may be some that aren't. So for those who aren't aware, we are located here in Phoenix at 27th Avenue in Union Hills, right off I-17 in Union Hills. If you need more information, you can go to our website, which you see listed there, gonsteadphysicalmedicine.com. If you have any questions after the class that you didn't get to ask me or any other health-related issues, feel free to shoot me an email, drtimko@gonsteadphysicalmedicine.com. You'll see at the bottom of the screen is a quote. I always like to start my classes off with a quote if you've been to one of my webinars or seminars before. This one, Hippocrates, over 2,000 years stated that all disease begins in the gut. He's a pretty wise man. I'm not sure that I agree with all of disease beginning in the gut, but I would say at least 90% or more does begin in the gut. And we're going to be talking about how the gut is interconnected with other parts and other systems in the body as we move on through the class. For those of you who aren't familiar with me, my name is Dr. Scott Timko. I'm originally from Western Pennsylvania. I did my undergraduate studies at the University of Pittsburgh. Went on to receive my doctorate in chiropractic degree from Sherman College of Chiropractic in Spartanburg, South Carolina. I've been in practice for over 25 years now, and in that time I've taken hundreds of hours, seems like thousands of hours, in continuing education, of course furthering my knowledge in the fields of chiropractic, but also in the physical rehabilitation and functional medicine. And so that's where my knowledge comes to you tonight in teaching a class like this. So let's start off by talking about the importance of gut health. I know gut kind of sounds like a harsh term, so let's describe what gut is. Well, the gut is really what we call the gastrointestinal system. And you can see by that word, if we break it down, gastro means stomach, and intestinal means the small and large intestine. So when you hear me say gut throughout the class, we think of the stomach and the intestinal tract. And we know that the gastrointestinal system is truly a gateway to overall health and well-being. The gut microbiome is an ecosystem of organisms, including bacteria, yeast, fungi, viruses, and even protozoan that are present throughout the whole digestive tract. In fact, it's been said that the average human being has over 7 pounds of these organisms within the gastrointestinal system. Pretty amazing to think of that. Aside from just digestive health, the following organ systems are also closely related to gut health. And we talked about the interconnectedness of the body before, but directly we know that the immune system, the endocrine system, the central nervous system, the circulatory system, respiratory system, reproductive system, and the integumentary system, which is your skin and hair, are all directly tied and related to gut health. Now, we hear that term IBS. What is it? Well, it stands for Irritable Bowel Syndrome. Irritable Bowel Syndrome is a chronic gastrointestinal disorder. It's characterized by a host of different digestive dysfunctions and discomforts, such as frequent abdominal pain, gas, bloating, indigestion, and often alternating constipation and diarrhea. Sounds fun, doesn't it? The symptoms and level of severity vary greatly between individuals, but this digestive disorder can be quite disabling. Now, the key in that first sentence up there is that it's a chronic gastrointestinal disorder. So this isn't something that you go around and you say, oh, I've had IBS the past week. Well, you may be beginning to have IBS, but for it to actually be diagnosed, the disease needs to be around for at least 3 months or longer, as it is considered chronic. And once you do have it, you've been diagnosed with it, or even before you're diagnosed with it, we know that it can be quite disabling, and people have a multitude of symptoms that go along with it, as we've mentioned, and many more as well. So there are other gastrointestinal disorders that may mimic the symptoms of irritable bowel syndrome or have their own symptoms but are related to gastrointestinal disorders that we're going to be talking about here today. So I wanted to bring those up. Some of those are acid reflux, heartburn, or even hiatal hernia. We have diverticulosis and diverticulitis, Colitis, another inflammatory bowel disorders. If things stay around long enough and the pH is imbalanced, you may develop ulcers. Some of the autoimmune diseases are celiac disease or Crohn's disease. We also can be infected with things like candida, yeast, parasites. SIBO, S-I-B-O, stands for small intestinal bacterial overgrowth. We can also develop food allergies or food sensitivities. We can also end up with malnutrition, and not the wasting away malnutrition that you may think of, but you may not be absorbing your minerals properly. Calcium and magnesium are big ones. Zinc is another one. The B vitamins, particularly B12, your iron levels can be out of balance. All of these things can create a malnutrition state. Now, we know that it is a common disorder, but it is underdiagnosed. So irritable bowel syndrome is the most common functional digestive disorder. Unfortunately, it's also one of the most underdiagnosed conditions in the United States. Some reports estimate between 38 to 96 million. You can tell it's a vast range of Americans suffer from irritable bowel syndrome in their lifetime. Yet only 5 to 7% of them receive a proper diagnosis and therefore receive a proper treatment. And even those who are getting proper diagnosis, especially through the allopathic community, the medical community, are often only being treated for their symptoms and not really getting any cure for their underlying problem. And one of the reasons they're being or underdiagnosed is because it's not an easy diagnosis. There's no one individual lab test that we can use out there and say, oh yeah, you have the IBS marker, so you have irritable bowel syndrome. IBS is diagnosed through the process of exclusion, meaning we look at it and say, oh, you don't have celiac disease, you don't have Crohn's disease, you don't have diverticulosis, you don't have diverticulitis, but you have these other symptoms, so you must have irritable bowel syndrome. We know that doctors are unable to accurately identify a diagnosable condition because, again, there's no specific lab markers for these diseases or for this disease. This process strengthens conventional medicine's methods of symptom management versus uncovering the true cause of the dysfunction. So they know that you have the symptoms and they finally put a diagnosis on you and they say, you know what, the only thing that we can do for you is just to manage these symptoms. And so take XYZ medication for the acid reflux, take XYZ medication for the pain, take XYZ medication for the diarrhea, for the constipation. So they're managing the symptoms, but they're never getting to the root or the true cause of the dysfunction. That's where functional medicine comes into play. Functional medicine are treatments that focus on optimal functioning of the body and its organs. Functional medicine addresses the underlying cause or causes of disease. Instead of treating the symptoms directly, true healing comes from finding the root cause of the problem, which are often alterations in healthy structure, and then correcting that underlying cause. That doesn't mean we overlook or ignore the symptoms. Certainly we want to help the symptoms to get better, but we're not just treating the symptoms specifically, we're treating the cause of those symptoms. So having said that, what are some of the common causes of irritable bowel syndrome? What are some of the things that we can look at? Although irritable bowel syndrome is not formally classified as an autoimmune disease, it shares many of the same risk factors, potential causes, and complications. And so some of these things that we're going to be talking about are not only prudent when treating irritable bowel syndrome, but also when we're looking at some of those other diseases we mentioned or those disorders we mentioned earlier, such as celiac disease, Crohn's disease, diverticulitis, diverticulosis, acid reflux, hiatal hernia, et cetera, et cetera. And so a lot of these causes may be related to those disorders as well. And so if you've been diagnosed with one of those, stick around, we'll be covering all those bases as well. So what are some of these causes? Well, we start off with external things we're putting into our body, such as poor diet. We also can develop something called leaky gut, which we're going to be discussing very much in detail here in a moment. We can develop food intolerances, such as food allergies or food sensitivities. We may have an overgrowth of yeast or candida in the body. We may develop a parasitic infection or a bacterial overgrowth in the body. Things that can create inflammation in the body that we're putting into our body are things like antibiotics, toxic exposure to chemicals, and maybe those are mercury or lead or arsenic. We can have chronic infections in the body as well that are causing these types of symptomology to occur. Other potential causes are psychological issues, particularly stress. We can have hormonal imbalances that can create problems within the gastrointestinal system. Remember, we said that the reproductive system and the gut are directly tied together. Genetics can also play a role in this. Again, because we think that it does have some autoimmune relationship as well, genetics can play a role. So let's go through and talk about some of these potential causes, what they are, and of course, how we treat those. And we're going to start off with leaky gut. I know I hear a lot of people mention leaky gut, and I'll say, well, do you know what leaky gut is? No, I'm not really sure what it is. Well, let's talk about what leaky gut syndrome actually is. So one of the most vital and basic duties of the cells that line the intestinal wall, called the villi and the microvilli, are to regulate intestinal permeability, or the leakiness of the gut. We certainly don't want it to leak. We want it to be, we want those cells to diffuse or absorb the nutrients that they want and let things that they don't want pass by. That's called selective absorption. However, when the cells become damaged, particularly due to inflammation, they begin to break apart. And in turn, this will allow particles to travel throughout the body that weren't meant to travel throughout the body. These could be bacteria, they could be viruses, they could be larger than normal food particles, that these things can get into the bloodstream and wreak havoc. As this happens, the immune system attacks these substances as they are seen as foreign invaders or pathogens, and the body will produce antibodies to fight those off. Even if there's something that maybe were good for us. It could be a food particle, but that food particle is larger than the body's used to seeing, but it was absorbed through that leaky gut, and now the body begins to fight it off. So that's how we develop food allergies or food sensitivities. This is a picture of the intestinal tract, and I'm going to mark this here with my laser pointer. And so you'll see this area right up here is the area where the food particles and all the biome is located. And you can see that this picture right here represents a villi, and the little finger-like projections here are the microvilli. Now again, these microvilli are supposed to selectively absorb what they want from the gut, absorb them through the villi and into the bloodstream to go throughout the body and to be used as necessary. But when we have leaky gut, what occurs is we can have fractures between the walls of the villi called paracellular penetration of antigens, or the villi can break themselves, and then we can have transcellular penetration of antigens that leak into the bloodstream. So this is a picture of what leaky gut actually is. So how does the gut get leaky in the first place? There are several factors that negatively affect the gut's integrity, one of them being the standard American diet. We can use the acronym for that, S from standard, A from American, D from diet, and our diets are SAD. We have exposure to chemicals, including medications. We can have chronic infections. We can have sensitivities or allergies to gluten, grains, or other foods. Excessive medications, in particular, non-steroidal anti-inflammatory medications, antibiotics, and antacids, all these things can create leakiness within the gut. Of course, we mentioned stress and its effects on us earlier. And then inflammation. And now whether the gut creates inflammation or inflammation creates the leaky gut, it's kind of a catch-22, but they're certainly associated with one another. So let's go through some of these and talk about some of these problems that can create leaky gut syndrome. And let's start off with food intolerances or food allergies or food sensitivities. We know that food intolerances, allergies, and sensitivities can all contribute to significant digestive distress. Now we need to separate a little bit the difference between an allergic response and a food sensitivity or a food intolerance. A food allergy is what we call an IgE response, and that means that it's an immediate response in the body. For example, you eat a peanut that you're allergic to, and you can go into anaphylactic shock, you can get runny nose, you can start sneezing or things along those lines, and those are an immediate allergic response. But the food sensitivities are what we call an IgG response, or immunoglobulin G. Immunoglobulin G is the most abundant antibody in the body, but it has more of a delayed response. And so you have a particular food or something that you have a sensitivity to, and the body may not respond to it for 12 to even 24 to 48 hours later. So it's hard to track these sensitivities down, because I may have gluten today and I may feel fine with it, but tomorrow, right after lunch, I start to get bloated and I'm like, wow, whatever I had for lunch really caused me a problem, but it wasn't what I had for lunch today, it was what I had yesterday that caused the problem, because this is a delayed response. And so it's difficult to determine exactly what these sensitivities are without testing. So testing the levels of these antibodies, the IgG antibodies in the blood, can be an incredible tool to indicate adverse food reactions. And I'll be talking more about some of this testing and what type of testing we use as we move along. Another problem that can create leaky gut and lead to irritable bowel syndrome is what's termed SIBO, or small intestinal bacterial overgrowth. Studies have reported that approximately 80% of people with irritable bowel syndrome suffer from small intestinal bacterial overgrowth. SIBO occurs when there are imbalances in the gut bacteria, resulting in an overgrowth of those bacteria. Now, we know that we have bacteria within the gastrointestinal tract. They are called the good bacteria are probiotics, but then we have other bacteria in there as well. The good bacteria are supposed to keep the bad bacteria in check. But if we have an imbalance of the good bacteria, particularly if those good bacteria are killed off by, again, things like antibiotics, non-steroidal anti-inflammatories, birth control pills, heavy metals, and other toxins, then the bad bacteria can overgrow, and that's what we're talking about here. It's fueled by a diet heavy in sugar, alcohol, refined carbohydrates, as well, again, as the use of antibiotics, antacids, and steroids, including those non-steroidal anti-inflammatory drugs that we talked about. And so these things will actually, the foods, the sugar, the alcohol, the carbohydrates, actually feed the bacteria and allow them to grow even more aggressively. Now, we mentioned candida and yeast infections earlier as a potential cause of leaky gut syndrome leading to irritable bowel syndrome. So let's talk about that a little bit more. Yeast overgrowth is similar to SIBO in the sense that it's caused many irritable bowel syndrome symptoms in response to an imbalance within the gut flora. Once again, yeast is common within the gastrointestinal tract and is supposed to be there. But again, it's supposed to be kept in check. When it becomes overgrown or overabundant, that's when it can create a multitude of problems. The most common form of yeast overgrowth is candida, which is a type of fungus that is, again, naturally present in our mouths and in our intestines. In excess, though, candida contributes to the breaking down of the intestinal wall that is common characteristic of leaky gut. In fact, candida, as it begins to overgrow, starts to produce toxins that will create inflammation within the gastrointestinal tract, leading to leaky gut and causing a multitude of symptoms, including IBS. So one of the other triggers for leaky gut and for IBS are parasites. Now, here in the United States, we don't think of parasitic infections as being something that's really common, but parasites are much more common than most people realize or would consider. Contrary to popular belief, you do not need to travel to high-risk areas to be exposed to them. In fact, conservative estimates say that over 20% of us have some sort of large parasite, meaning the worms, the hookworms, the tapeworms, the flukes, the pinworms. So 20% of us have those parasites within our bodies. If we include the single-celled organisms, such as the amoebas and even candida in that, then we could say upwards of 80% of us have some sort of infection within the body. So those are pretty high numbers. Since these parasites are usually ingested through the food we eat or through water, the most common issue they contribute to is digestive damage and compromised nutrient absorption. They will alter the absorption of our nutrients, but they also use the nutrients for their growth as well. So they're scavenging on us, hence the term parasite. So what we want to do is skip the guesswork. We don't want to say, well, gee, I wonder if I have a parasite, or somebody told me I have candida, or gee, do I have leaky gut syndrome? we want to make sure that we are getting the proper diagnosis for these symptoms and for these disorders. Although there's plenty of research on the dangers of irritable bowel syndrome and leaky gut, it is still considered a medical mystery, as we mentioned earlier, as hence the diagnosis of exclusion. Many cases go misdiagnosed and in turn are not properly treated. It is crucial to work with a doctor who's familiar with this condition and will perform the appropriate tests in order for you to heal effectively and efficiently by, again, getting rid of the cause of the problem and not just treating the symptoms. So we need to make sure that we are having the proper testing performed. Having the proper diagnostic testing performed is essential to determine the underlying causes of irritable bowel syndrome. With a proper history, examination, and testing, we are then able to determine the correct treatment protocols necessary to allow the body to begin the healing process, and of course then eliminate the associated symptoms. And so we want to make sure that we are determining through our history, our exam, and our paperwork, including things like symptom survey forms, food and chemical sensitivities, neurotransmitter assessment, toxicity questionnaires, and others. Then from looking at these questionnaires, from doing a proper history and examination, we can say, you know what, I believe it's pointing us in this direction, and here is the test that I believe that we should start with. So what are some of these essential diagnostic testing that can help us determine the underlying cause of your problem? Again, first and foremost, a complete and thorough case history physical exam and questionnaires are essential in allowing your doctor to determine what direction that we need to go. In almost all cases, we're going to want to start off with some blood work. The first place, obviously, to start with any of these conditions is to have a full blood panel performed to rule out more serious issues and also guide us in determining the need for further diagnostic testing. Now, most of you have had some sort of yearly blood test done, of which you have a CBC or complete blood count, maybe a comprehensive metabolic panel, and maybe even a lipid panel. And oftentimes that's a good starting point. But there's other tests that we really need to look at. And I'm going to go over what those are with you in just a little bit. But we do need to get some comprehensive blood work done. Once we do, then we can look at some of these other testing. The intestinal antigenic permeability screening is a test for leaky gut. It actually looks for antigens within the blood to determine if we have a leakiness that's occurring. It can also give us an indicator if you potentially have parasitic infections, bacterial infections, or even candida. So this is a good place to start to determine if you do indeed have leaky gut. And if so, then it's going to lead us in another direction to test for some of these other potential causes. Food sensitivity testing is extremely important. Remember, we said larger than normal food particles can travel through the system. They can create an immune response within the body. This immune stimulation test can help to identify these substances. We'll use a wheat and gluten proteome reactivity test to determine if you do have gluten sensitivity. We may also do a gluten-associated cross-reactive foods test. The gluten-associated cross-reactive foods test is really important for anyone who has been diagnosed with gluten sensitivity because you are therefore going on a gluten-restricted diet or a gluten-free diet. But a lot of the other grains have similar amino acid sequences as gluten. And so even though something says it's gluten-free, it may have amaranth or whey or sorghum or millet in them. And those have similar amino acid sequences as the gluten and may have the same response. So this is another test that we can do, especially for those with gluten problems. And then we can do a multi-food or chemical sensitivity testing, because there's a lot of people out there that are having sensitivities to things like tomatoes or nightshades or any of these other foods that could be common foods that you're eating on a daily basis. And so we need to check those foods to see if you have sensitivities to those that are triggering this inflammatory response within the gastrointestinal tract. The next test that we might want to look at is a comprehensive stool analysis. This will detect the presence of pathogenic microorganisms, particularly parasites, but also in some senses yeast and bacteria. And finally, we can use a dysbiosis test or an organic acid test. This tests the byproducts of certain bacteria, viruses, and even some parasites, and it allows us to determine which specific problems are going on within the gastrointestinal tract, and particularly with things like SIBO. And so these are some of the testing that we might be looking to perform with you to, again, get to the underlying cause of the problem. Then we can look to rectify that cause. So once we've determined that you have an issue, we like to use what's called the 4 R's, the 4 R's of intestinal healing. The 4 R's program is administered to heal the body from digestive distress. It helps to reverse gut complications and rebalance the gastrointestinal microbiome. We as functional medicine practitioners are trained in this protocol, and we're really excited about using it with you and helping with your individual needs, and so we can address those during the process of healing. So it's a really fun thing to do to get to the underlying cause of the problem and then begin this healing process. So let's talk about these 4 R's and what these R's are. So the first R of treating intestinal inflammation is to remove the irritants. And so we need to eliminate problem foods. We do that through either an elimination diet or through that food sensitivity testing we said. We need to eliminate toxins, and we may need to do additional testing. We may need to do tissue mineral analysis to see if you have toxins in your body, such as heavy metals, mercury, lead, arsenic, etc. We need to determine if you have those infections, as we've mentioned, bacterial infections such as SIBO, or maybe you do have parasites in there. We need to remove those. And then we need to get rid of the oxidative stress by giving the body the nutrients it needs to begin to heal. So again, we're going to remove these irritants once we determine what they are. Secondly, the second R is to replace the nutrients. If you have irritable bowel syndrome, if you have leaky gut, you have been on a nutrient deficient process for quite a while now. The body just isn't absorbing the nutrients we need. So we need to help it a little bit. We may need to replace digestive enzymes or antioxidants or immune boosting vitamins and minerals. The third R of intestinal healing is to restore the good bacteria or the probiotics. We need to repopulate your gut with the good healthy bacteria. And the final R is to repair the leakiness. Just like a plumber repairs your pipes to keep them from leaking, we need to get rid of that leakiness within your gut. So we need to begin by introducing a clean diet with essential nutrients and then other things to help heal. So let's go through each of these individually, talk about them a little bit more because they are extremely important for anyone dealing with gastrointestinal problems. So the first R, again, was to remove the irritants. And so we need to detoxify or cleanse the body. We know that exposure to toxins, when we are exposed to those, we experience all kinds of problems. We have weakening in our immune system, digestive dysfunctions, and it truly depletes our bodies of its ability to heal because we're using our energy to get rid of these toxins out of our body and not using our energy to heal. Different forms of toxic exposure includes pesticides on our food, herbicides as well, air pollution, water contamination, toxic chemicals in our household and cleaning products. And so these can not only affect our gut, but affect our liver and kidneys as well. So part of a good cleansing and detoxification program not only is going to cleanse the gut, but it's also going to heal the organs of detoxification. We know internally toxins can come in the form of overgrowth of yeast, parasites, and bacteria, as we mentioned, so we can't overlook those. So part of our detoxification program may be specifically targeting those yeast, parasites, and or bacteria. Now, the second R of intestinal healing was replace the nutrients. So we mentioned digestive enzymes. Digestive enzymes are probably one of the most important things that you can use to help your body eliminate some of the symptoms of irritable bowel. And so we know that digestive enzymes assist in the breakdown of food and they aid in nutrient absorption. Some of those enzymes actually come in the food that we eat. In fact, if we eat good, healthy, whole foods, they already have enzymes within them. The problem is that we overcook a lot of our foods and we break those enzymes down, or we eat processed foods that don't have the enzymes in them. So therefore, we're relying on our body's enzymes. We do produce pancreatic enzymes, protease, lipase, and amylase to break down proteins, fats, and carbohydrates. We produce enzymes in our saliva to begin the digestion process. We also produce hydrochloric acid in our stomach to break down the foods. And then bile, which is produced by the liver and excreted by the gallbladder, also helps to break down and emulsify fats. And so all these things can be replaced as necessary for each person's individual needs. Taking digestive enzymes may reduce many of the discomforts people with IBS experience. Some of these are gas, bloating, uncomfortable fullness, and abdominal pain. So if you're experiencing any of these, one of the first things that you want to start with is a good digestive enzyme. The type of enzyme recommended may vary depending on your individual needs, whether you're having difficulty digesting proteins or carbohydrates, whether you're not eating the whole foods, whether your pancreas isn't producing those enzymes, and your doctor can help guide you in which particular enzyme is going to be best for you. Now, continuing on the replacing the nutrients, we want to add some additional supplements into our diet as well. You know, other important nutrients suggested for IBS include the fiber, which helps with the peristaltic action of the body, which is how we move foods through. So if you're constipated, you may not be getting enough fiber. We have anti-inflammatories such as turmeric. That can help reduce inflammation in the gastrointestinal tract. Omega-3s are important for cellular health. Minerals such as calcium and magnesium are calming to the body. We have amino acids such as L-glutamine, which is healing to the villi and the microvilli. We have quercetin, which acts as an antihistamine, which may help with some of those food sensitivities. Glutathione is an antioxidant and a cleanser. It'll detoxify the liver, the kidneys, and the gut. Herbs such as slippery elm or aloe vera, marshmallow root, licorice root, all of these are contact healers that will help with that leaky gut. So again, your doctor will decide what's going to be best for you, but these may be some of the nutrients that we may recommend for you. Now, we also said when we're replacing the nutrients, we want to restore probiotics, so the good bacteria. So that was the third R of intestinal healing. Probiotics, of course, are live bacteria. They promote healthy balance of bacteria through the digestive tract, and they keep the bad bacteria and the candida in check. They can be naturally found in foods such as yogurt, kefir, sauerkraut, tempeh, miso, kimchi, or kombucha. But when we are sick, when we have irritable bowel syndrome, we have other gastrointestinal disorders, it's probably not enough to get those from foods, so we need to supplement those. We also need to use prebiotics, which is essentially the food for the probiotics. They are types of plant fiber that act as fertilizer or food for the probiotics. And so oftentimes when somebody has an issue and they're taking probiotics, they'll say, well, how many are you taking? They'll be like, well, I'm taking acidophilus, which is a strain of probiotics, and that's great. I'll say, how much are you taking? And they're saying, well, I'm taking 5 billion CFUs, which sounds like a lot. But 5 billion CFUs when it comes to probiotics is actually a very small amount. And also taking one strain is not enough. Oftentimes, we'll recommend 8 to 10 different strains of probiotics, and those aren't 8 to 10 different supplements. They're all within one particular product. And oftentimes, I'll recommend up to 75 to 100 billion CFUs of probiotics to help the body restore that while we're going through that healing process. The third R of intestinal healing, the fourth R is to repair the leakiness. And so now we need to heal that gut. As we know, the lining of the gut must have proper permeability and integrity so it can not only absorb nutrients, but again, prevent toxins and allergens and microbes from gaining access to the bloodstream. Specific nutrients, including glutamine and flavonoids and plant sterols, again, from those phytonutrients that we get from things like aloe vera, marshmallow, licorice root, slippery elm. All of these are essential in reducing intestinal inflammation and help healing the intestinal mucosa. Also, balancing your body's pH, which is your acid and alkaline levels, plays a vital role in not only your gut health, but in maintaining your overall wellness. In fact, one of the first things I do with my nutrition patients is I send them home with some pH test strips, and we test their first morning urine, which gives us an indication of the body's pH levels. and so your pH needs to be in an alkaline state for you to be healthy. Unfortunately, a lot of people with chronic illnesses end up being more acidic, which creates more inflammation in the body. And so we need to look at that pH. We need to help to restore that pH to the alkaline side to help the body heal. So we've gone through the 4 R's of intestinal healing, and that's certainly a great starting point, but it's not the only thing we need to do. There are other things that we need to do to help the gut to heal. Last, but certainly not least, is to relieve some stress. Now, I could do a whole class on stress, and maybe we'll do a webinar on stress coming up here soon. But obviously, stress can create a multitude of problems. And managing stress is one of the most single-handedly important things you can do to support and optimize and sustain good health. Studies have supported that higher stress levels increase the rate of IBS and the complications coming from that. So we know one of the stresses that can occur in the body are structural stresses. And that structural stresses can come from imbalances within the spine. You didn't think you were getting out of here without talking a little bit about chiropractic today. So since the nervous system controls and coordinates all functions of the body, any alterations in its function can have severe repercussions on our health. If there's an interference in the transmission of impulses along a nerve that supplies one or more of the organs and systems we mentioned earlier, then improper function of that organ or system can occur. That interference is called subluxation. So a subluxation is simply a misalignment of a vertebrae that puts pressure on the nerve and decreases impulses from the brain to the body or from the body back to the brain. This chart shows where misalignments in the spine can occur and what problems can happen. So looking at this mid-back here, what we call the thoracic spine, where your rib cage is at, the nerves that come out of this region, particularly around T5, go directly into the stomach. As we move farther down the thoracic and get into the lumbar spine, these are the nerves that go to the small intestine and into the large intestine. And so misalignments in these areas are very commonplace with people that have irritable bowel syndrome. And so just looking at you from a nutrition standpoint isn't always enough. We need to also look at you from a structural standpoint and correct those structural imbalances to help the body heal at 100% of its ability. Well, now what? And I love that picture. If any of you have seen Finding Nemo, you know that these little fish were in an aquarium in the dentist's office, and they finally made their way out. They made it to the ocean, but now they're stuck in these plastic bags. I'm sure they all looked at each other and said, now what? Well, as you know, if you saw the movie, they did get out, and we're hoping to remove you from that plastic bag of symptoms that you are experiencing now. So what do we do? How can we help you? Well, if your IBS or other gastrointestinal problems are keeping you from reaching abundant health and vitality, we need to do something about that. We need to get the proper neurometabolic testing and then the proper treatment performed to help you find out what's really causing your health issues. Once the cause of your problem is found, then you can truly begin the treatments that are going to help you to heal. So I want to thank you for attending the seminar. I want to thank you for taking your time to join me here today. Again, the class isn't over. We're going to be taking some questions here in a little bit. So this is your cue. If you do have questions, you go ahead and click on that Q&A, and we'll get to those here in just a moment. So again, Combating IBS, Understanding Recovering Digestive Disorders was brought to you by Gonstead Physical Medicine.